Hi, I'm Grace O'Connell. I'm a professor in mechanical engineering at the University of California at Berkeley, and my research is focused on biomechanics. And this week I thought I would cover one of the journals that I read recently in the Journal of Orthopedic Research, looking at how yoga can help people with lower back pain, chronic lower back pain. And before I can really talk about the study and what the study found, I thought I needed to give some background in terms of chronic lower back pain and the hip-spine complex and how the hip and the spine work together to cause some issues that can make it complicated to figure out where the pain is actually originating from. For patients that have lower back pain, or LBP, most cases it's non-specific. So you can get images done, you can do a bunch of testing, and you can't really tell where the pain is originating from. And that is about 90% of the cases. In about 10% of the cases, you'll see signs on the images where you'll have a herniated or a bulging disc, and it's very clear where that damage has originated, which is causing pain. And when you have a herniated or bulging disc, that disc material will push back on the spinal cord located behind the intervertebral disc, and then that can cause pain that radiates down from the lower back and even to the legs. This is called sciatica. Back in 1983, Drs. Ofersky and McNabb introduced this idea of the hip-spine complex, or the hip-spine syndrome, where the idea is that the hip and the spine are two joints that are very much interlinked with one another. And when they looked at a subset of 35 patients, they saw about half of the patients had simple hip-spine syndrome, where they was easily able to define whether the pain was originating from the hip or from the spine. But that in the other half of the cohort, there is a complex hip-spine syndrome where the pain could either be from the hip or from the alignment of the spine. And so for this, where there was concurrent pain in the hip and the spine, they called it a complex hip-spine syndrome. Often for non-specific lower back pain, non-surgical treatment options are explored first, and this largely includes physical therapy, learning exercises to strengthen the joints and to strengthen the symmetry of the joints, for example, the anterior and the posterior part of the spine. The hip and the spine together presents two joints that cause a significant amount of debilitating pain worldwide. Osteoarthritis, or the degradation of the articular cartilage in joints like the hip, the knee, and the shoulder, is the number one leading cause for disabilities. And number two, right behind that, is lower back pain due to disc degeneration and changes in the spine itself that can cause debilitating back pain and leg pain. And you can see in this image here where we have young, healthy discs that have a significant height to them, and as we age, that disc height decreases until at some point you might have bone on bone. And this is true for osteoarthritis, as well as the cartilage degrades over time, resulting in bone on bone contact, causing that painful experience, that debilitating pain. So why did this group look at yoga in terms of trying to treat chronic back pain? Well, we need to step back and look at how people have connected hip movements to lower back pain. And I want to present a couple of studies that looked at athletes, and they recruited judo athletes that have reported lower back pain, as well as those that didn't have lower back pain. And they age and BMI matched and weight matched all of these two groups. For these two groups, then they looked at a common assessment in physical therapy, looking at the hip rotation and the hip flexibility. So looking at internal rotation on the non-dominant side and internal rotation on the dominant side. So when we look at the internal rotation on the non-dominant side, we see that the lower back pain group had internal rotation either when this is done actively by the participant or passively by the physical therapist. That internal rotation is about 20% lower than the control group. For internal rotation on the dominant side, again, we see this decrease in the lower back pain group. However, it's not as significant on the dominant side as it is on the non-dominant side. So there's about a 10% decrease in the amount of internal rotation. So you can say that their hip joint is a bit stiffer in this case. And if we look at this together, looking at the behavior of non-dominant versus dominant within a group, we see that the control group is not affected by whether or not they're doing internal rotation of their non-dominant side versus their dominant side. But for the lower back pain group, which you can see with the orange line here, or the orange dashed arrow, the internal rotation is more impacted on the non-dominant side. This study also looked at external rotation for these athletes. There's no difference in external rotation for non-dominant versus dominant, and for lower back pain versus the control group. So for the lower back pain group, there is some stiffening in the hip joint that affects the internal rotation. And this study, while done on judo athletes, both male and female, I included it here, but it's not the only study that has looked at differences in internal rotation and external rotation. I have some examples of a couple of studies here where one looked at the general population, however it wasn't age matched, but they also saw differences in internal rotation. And similarly, for a couple of studies that looked at male tennis players and male golfers, there was a significant difference in hip rotation between the leading and the non-leading hip, or another way of saying it, their dominant versus non-dominant hip. So these studies have provided a lot of evidence that the hip and the hip stiffness is associated with patients that report chronic lower back pain. And this recent paper in the Journal of Orthopedic Research looked at how applying all this background knowledge from previous literature and looking at how yoga might help to strengthen as well as stretch the muscles that may be pulling onto the hip joint and tightening that hip joint, and then looking at how that impacts lower back pain. So in this particular study, they recruited only women, 11 in the control group with no back pain and 10 participants with chronic lower back pain, where the average age was around 24 to 28 years old, depending on the group, and it was also BMI matched. So before they started the study, they recorded the participants' pain, so self-reported pain, as well as muscle activity. Then they had the participants do yoga twice a week for 4 weeks, so a total of 8 sessions. And after each week, they evaluated the muscle activity using surface EMGs, and they did a self-assessment to look at what is the pain score, the VAS score. And yoga has a long history in ancient India for mental, physical, and spiritual health. In this context, it's more of the westernized approach to yoga, where it's looking at the physical health and the strengthening health of that. There were many poses that were included in the asana protocol, and the study presented all of the poses that were included. And you can see that many of them included hip stretching. To measure the muscle activity, they use surface EMGs, which measures the muscle activity when activated. And they placed it on the multifidus, particularly around the L4, L5 motion segment. And they kept it in the same spot throughout the study. So they left it there for the entire month. And they had the participant flex forward as much as they could voluntarily on their own, and then they would measure that activity. They used that to calculate an FRR ratio so that they could compare from week to week and be consistent within a participant. Each week they had the participants provide their VAS score, so a rating of their pain, their lower back pain, on a scale of 0 to 10, 0 being no pain and 10 being the most amount of pain you could imagine. At the very beginning of the study, you see that the control group had no pain. They're down at the bottom in teal, whereas the chronic lower back pain group had an average score that was around 7.0. And with each week, that VAS score for the chronic lower back pain group decreased until about the 3rd week, where it starts to possibly plateau. We don't really know for sure if it plateaus or if it would continue to go down, because we only have 4 weeks of data here. But this is quite promising that some physical activity added to their daily or weekly activities help to improve that chronic back pain score. But that is very subjective, And so what this study actually did in terms of adding data to the literature beyond what other papers have done was actually measuring the muscle activity in the multifidus. For the FRR ratio, a lower ratio means more activity of the muscle. So for this, the FRR group for the control was around 11, and it was consistent throughout the entire study. And when we look at the FRR ratio, we see that for the chronic back pain group, there's actually improvements between the beginning of the study through the second time point, where it gets closer to what the control group is, not quite equal to it, but just below it. And just like the VAS score, the subjective pain score, this seems to also plateau in the last couple of weeks of the study. And so they used the time points, the 0, 1, 2 time points, that linear behavior, to predict out pain improvements over a period of 8 weeks, rather than just the 4 weeks that was included in the data analysis or the data collection. And so take this with a grain of salt anytime you have a predictive model. It's very challenging to predict the future. And so with this, they show that the controls would continue to stay flat, maybe slightly decrease, whereas the chronic low back pain group, they predict would continue to improve until it was equal to that of the healthy group within a period of about 8 weeks. So this isn't the first study that showed improvements with pain with yoga or with physical activity, but this study does add quantitative metrics to the analysis by including both the subjective pain score with the quantitative muscle activity measurement. Of course, one thing that would be interesting to see is if the chronic back pain group continues with the yoga or the physical exercise routine even after completion of the study, and how does that relate to their overall pain? Because compliance in physical activities or prescribed physical therapy is a major issue in terms of outcomes and results of improvements. I'll also note one thing that would have been nice to see is what was the relative activity level of these participants before being included in the study. Overall, this was a really exciting paper to read. It's always nice to see researchers that are combining both the quantitative with the pain metric scores. It's very difficult to use pain as a measurement tool for these studies because it can be so variable and subjective from patient to patient, as well as within a patient from day to day. For example, in the judo study, we know that they were athletes, they were training about 10 hours a week, and they had some with chronic low back pain versus no low back pain. And I bring this up because it would also be interesting to know if, going back to the participants, maybe 1 or 3 months later, how many of them kept up with the yoga practice or physical activity practice, especially those in the chronic lower back pain group that saw an improvement in their pain over the 4 weeks of the study.